In this lecture, I will present the characteristic anatomical features for the maxillary second and third molars. The permanent maxillary second molar supplements the first molar in function. In describing this tooth, direct comparisons will be made with the maxillary first, both in form and in development. First, I will present principal identifying features for the permanent maxillary second molars. There is no fifth cusp, or the tubercle of Carabelli is absent in maxillary second. Therefore, the lingual surface of the mesiolingual cusp is smooth. The roots are less divergent and may be joined together. Both distal cusps, the distal buccal and the distal lingual, are less developed. In general, the crown is smaller in overall dimensions, mainly in the mesiodistal and the crown length. However, the buccal lingual dimension is the same as that of the maxillary first. Chronology for the maxillary second molar. First evidence of calcification is at the age of 2.5 years or 30 months. Eruption is between 12 to 13 years. Therefore, second molars are called the 12 years molars. From the buccal aspect, the crown is a little shorter cervico-occlusally and narrower mesiodistally. From buccal surface, the mesiobuccal and distobuccal cusps are seen. The distobuccal cusp is smaller compared with that of the maxillary first molar and less pointed. Buccal roots are less curved, less divergent, and have more distal inclination. The apex of the mesiobuccal root is on line with buccal groove of the crown. Moving to lingual aspect, both mesiolingual and distolingual cusp can be seen. The distolingual cusp is smaller and shorter. No fifth cusp is evident, therefore the lingual surface of the mesiolingual cusp is smooth. The lingual root is not as broad as that found in first molar. And as was mentioned for the buccal aspect, there is more distal inclination of the three roots. And the apex of the lingual root is on line with the tip of the distal lingual cusp. From mesial aspect, regarding dimensions, the buccolingual dimension of the second molar is the same as that for maxillary first, so it's broad buccolingually. However, the crown length is less. The fifth cusp is absent. If we examine the lingual aspect, two cusps only can be seen, mesiobuccal and mesiolingual. We can identify buccal from the lingual from root outlines. The lingual root is banana-shaped and slightly longer than the wider or broader mesiobuccal root. Both mesiobuccal and lingual roots are less divergent, therefore they are located within the confines of the crown outline, compared with maxillary first molar, where maximum contours or curvatures of both lingual and mesiobuccal roots were extending beyond the outline of the crown. From distal aspect, distolingual and distobuccal cusps are in view. They are smaller than those in the maxillary first. Therefore, more of the occlusal surface can be seen from this angle. Roots are also less divergent. This is the lingual root and this is the distobuccal. They are located within the confines of the crown outlines. The smaller distobuccal root is superimposed on mesiobuccal root. Therefore, we can see in the background the outline of the mesiobuccal root. Finally, the apex of the lingual root is in line with the tip of the distal lingual cusp. Regarding the occlusal aspect, there are two major types of a crown form for the maxillary second. The first, which is the most common and frequent type, is the rhomboidal form. Just resembling rhomboidal outline for the maxillary first, the rhomboidal form is more accentuated. The acute angles are more acute and the obtuse are more obtuse. Regarding dimensions, the buccolingual dimension is the same. However, the mesiodistal dimension is narrower by 1 mm. This configuration makes the rhomboidal outline more accentuated. The other characteristics include the distobuccal and distolingual cusps are smaller and less developed. There is no fifth cusp on the lingual surface of the mesiolingual cusp. The oblique ridge, which is formed by the union of the triangular ridge of the distobuccal cusp with distal cusp ridge of the mesiolingual cusp, is less prominent in the maxillary second. In addition, there are more supplemental grooves and pits on the occlusal surface of the maxillary second molar. The second form, which is less common, is the heart-shaped form, resembling a typical maxillary third molar form. In this form, the distolingual cusp is poorly developed or even sometimes missing. So you can see here there is two forms. The most common is the rhomboidal form, resembling maxillary first, and the second form is the heart-shaped form with a small distolingual or even absent distolingual cusp with only one large lingual cusp. This is called the heart-shaped form. Moving to the permanent maxillary third molar. Third molar is rarely as well developed as maxillary second, so it can present in different forms and in different sizes, as you can see in these two pictures. All third molars share common characteristics, whether they were mandibular or maxillary. They show a lot variation in development, more than any other teeth in the mouth. In addition, they have a greater tendency to be impacted compared to any other teeth. As you can see in this panoramic radiograph, maxillary molars are either partially erupted or even impacted when there is not enough space for their eruption. The same applies for mandibular molars. Third molars are the most common teeth to be congenitally missing. So they are the most common teeth to be presented with anatomic variation, the most common teeth to be impacted, and the most common teeth to be congenitally missing. The maxillary third molar shows the first evidence of calcification at the age of 7 to 9 years. Since it's the last tooth to be erupted into the oral cavity, it's the last tooth to show evidence of calcification. Enamel completed 12 to 16 years, eruption is 17 to 21 years, and root completed 18 to 25 years of age. What are the principal identifying features for the permanent maxillary third molars? The maxillary third molars often appear as a developmental anomaly. As was mentioned before, they can vary considerably in size, contour, and relative position. It is considered the smallest of maxillary molar. The crown is shorter cervico-occlusally compared to the maxillary second and first. Also, it's narrower both mesiodistally and buccolingually. Therefore, it's considered the smallest of the maxillary molars. From lingual aspect, only one large lingual cusp is present due to the small or absent distolingual cusp. Therefore, there is one large lingual cusp, and this will result in no evidence of a lingual groove on the lingual aspect. Viewing this tooth from proximal aspects, whether mesial or distal, shows that both the outlines of the crown and the roots are poorly developed and irregular, with more of the occlusal surface seen from the distal compared with the mesial due to the shorter crown length distally. Viewing this tooth from the occlusal aspect, the typical maxillary third molar presents a heart-shaped outline, as it's shown in this figure. This form is characterized with the presence of three cusps, the mesiobuccal, distal buccal, and one large lingual cusp, which is well developed. There is no lingual groove. The distolingual cusp is very small and poorly developed, or may be absent entirely. As it's seen in this figure, the distolingual cusp is absent. Here it is very small and poorly developed. In addition, there are many supplemental grooves and pits on the occlusal surface compared with maxillary second and first molars. The second form, which is less common, is the rhomboidal shape type with four cusps, similar to that of the rhomboidal type of the second molar. So four well-developed cusps can be seen: mesiobuccal, distal buccal, mesiolingual, distolingual, even a strong and well-developed oblique ridge, the lingual groove, distal oblique groove, and buccal groove. So it will be presented with a well-developed occlusal surface, but this form is less common. Regarding roots outline, three roots are found. However, they are shorter, more convergent, and often fused, functioning as one single large root. These three roots have a distinct slant toward the distal, even more than it's shown for the maxillary second molar.